Well, even though there's still snow on the ground, it is spring and spring allergies right around the corner. Dr. Justin Imhof with Hannibal Regional Medical Center joins us this morning to talk about all things fun with allergies. Good morning, Justin. First of all, how do you know you have allergies as opposed to just a persistent cold?
Well, that's a good question. They do have a lot of similar symptoms, usually the congestion, the runny nose, but typically a cold, you may have a fever associated with that, and cold caused by a virus will typically run its course or go away spontaneously within 2 weeks. If it persists longer than that, you may have some allergy type symptoms and you may want to consult your doctor.
What can you do with springtime allergies?
Well,
so you're not in misery for 3 or 4 months.
There's really a three-pronged approach to treating allergies, and the first of which is first identifying that you have them. If you do identify that you have them, there are several ways to be tested, and you can speak to your doctor about that, skin tests or blood tests. If you are an individual who is allergic to certain things in the environment, one of the ways in which we can deal with that is avoidance, simple avoidance. If you can identify that you're allergic to dogs or cats or certain tree pollens, flowers,
stay away.
Avoid those things in the springtime. Keep the windows closed, turn the air conditioning on. If you're going to be out mowing grass or something like that, a mask can sometimes be useful as well.
Now, and then there's medicine like the Claritins, the Zyrtex that you can take?
Yeah, the single best agent for allergic rhinitis or the nasal symptoms associated with allergies is still a nasal steroid, so a nasal steroid spray. Commonly available and used are antihistamines, and really to understand what antihistamines are, it's best to know what histamine is. And histamine is just a chemical that your body releases in response to an allergen, and it causes the congestion inside your nose, the runny nose, the itching, sneezing, and things like that. So antihistamines are really going to help with those symptoms.
Very nice. You always hear antihistamines. I didn't know that histamines was something you had in you.
Yeah.
Finally, real quickly, what about stuff like the neti pot?
The neti pot does play a role in allergy symptoms, and as Lindsay demonstrated earlier for us so well on the air, it does play a role because if you think of your nose like a filter, if you've seen on the afternoons where the sun comes in the window just right, there's all sorts of particles floating around in the air.
My favorite
Those things are everywhere all the time, and in those are pollens, molds, dust, and if you happen to be allergic to those things, they sit inside your nasal mucosa or on the little lining of your nose and initiate that allergic response. By using the neti pot, we can kind of wash those things through and not let them sit there as long and create that response.
So it just kind of washes it out like you would a filter?
Correct. It thins the mucus, and yes, it does. It provides a cleansing of the nasal passageways.
Interesting. Well, I've been blessed with no spring allergies, so I'm good. But if you have them, I know they're awful, so
absolutely.
See your doctor. Thanks, Dr. Imhof, for being with us this
morning.
morning.
You're welcome.